Congressman Levin, thank you very much for the introduction, and to all of our leaders, our elected leaders, and certainly our healthcare leaders who are here with us. I want to say thank you. Special thanks to Dr. Saeed for allowing us to be in this wonderful pharmacy, and thank you for the work that you do every day to help patients access the medications that they need. More and more, we're beginning to realize how important it is that we give people access to their medicines, not just early, but affordably, because too often people skip their medication. They get worse with their health because they can't afford the medication or they're not sure how to access it. Well, today's announcement on the rule that we have moved forward today is, as I believe, Bernita, you said, the largest expansion of access to contraceptives in over a decade. Yet the rule itself is very simple. The rule essentially says, one, you should not have to pay out of pocket to get the contraceptives that you need. And two, you should not have to come with a prescription in every case for certain types of contraceptives. When you limit access to contraceptives, you limit the care that some Americans need. And we have seen the case apply that there are a lot of women, a lot of families that don't end up with the contraceptives that they need, principally because they're not sure they can access them because they don't have a prescription, or because they don't have the money to pay for those contraceptives. This rule is a straightforward acknowledgement by this administration, once again, by President Biden and Vice President Harris, that every American should have access to the health care that they need. And everyone should get to make the determination themselves about what is best for their health care after consulting with their physician. So we're trying to move forward with something that simply makes access to health care more affordable and more available. And the more we do that, the more America will be healthy. I want to thank all the leaders in Congress, including our two members who are here with us today, for their work to try to ensure that all Americans have the access to the care that they need at an affordable price. I want to thank all the health care givers who have worked very hard to ensure that people can essentially get the care that gives them the right to be healthy. And I want to thank each and every American who's fighting to make sure that we can move forward to make reproductive health care available to everyone who needs it when they need it, regardless of what their income is, what their zip code is, or what their status is. We're going to continue to fight for that as much as we can. And I want to make sure I acknowledge one other person who I know has been working pretty hard on this for quite some time, actually two people. One is the Chief of Staff of the Department of Health and Human Services, who often doesn't get mentioned, Sean McCluskey, because it was Sean's initiative that actually brought to HHS and to CMS the impetus to move this, because it became very clear that there was a need to make this a much simpler process for everyone. And the other person is Amy Moy, who I know in the last 4 days, probably we didn't give her much chance to rest, because she is the one that helped bring all of us together so that we could present this information to you. So to the two of them, although they won't be speaking, I want to acknowledge their great effort. They deserve a shout out for all they've done to make it possible for us to issue this rule and hopefully have it implemented very, very soon. With that, I think we're ready for some questions.
Yeah, we're going to open it up for questions. Please, questions to stay on topic. If you have a question, please raise your hand.
Yes.
Secretary, what needs to happen?
And give us your affiliation.
John Farrell with KPBS. What needs to happen now? I wasn't clear whether this is Congress needs to do something, or you can say it's make it so.
Not quite either, although I'd love to be able to say make it so. And Congress is right now in their recess, but we'll be going back soon. The rule was introduced. We now will go through a 60-day comment period. After the 60-day comment period, where we take into account all those comments that come in, we then issue the final rule, which then will become effective upon issuance.
Javier, we're still working this. We're kind of recess. I'm wearing a suit.
Yeah, well, that's true. I recall my congressional days. Yes, you're working harder probably at home in your district than you were in Washington D.C. It's moving forward. Yes, and we'll take into account any comments that we receive to see if there's a need to shape it better. But otherwise, moving forward, 60 days.